should a person do it? Because I have heard people say, well, you should not do it. And, when you talk root canal, you talk a lot of money, right? People
Mhm.
say it's too expensive. Then people say well, it didn't worth it after 10 years. Listen, I'm only telling you what I hear lay people who have
Yeah.
no connection with it. Then you hear, but most of the time, it's all about the positive. You need to do it. All right. So tell us again what and when and what are the reasons and what are the signs that a person needs to do a root canal and what is really a root canal?
Okay. So majority of the time we need a root canal when a cavity is big, right? So when the cavity is growing and it's leading to your nerve. Most patients will start feeling some sort of discomfort there. So they're
Okay.
having like minor cold sensitivity. It'll progress and get into hot sensitivity and then eventually lead to throbbing pain. Okay. Toothache is not fun. Anyone who's experienced it, they know it can feel, it's terrible. It keeps you up at night, gives you migraines, gives you throbbing pain. You're on medications to try to lower your pain. But what's eventually going to end up happening is that tooth will just die and your symptoms will just go away. But what is that going to lead to? An infection. So you want to take care of it at the early stages and do the root canal. So what a root canal really is it's we're just going into the tooth and we're removing the nerve of the tooth. Okay, it sounds painful. It's not. Once you're numb, you're good. Yes, in the past, anesthesia wasn't the strongest at that time. Now, as dentistry's evolved, we have better material, better techniques to numb a patient. So once you're fully numb, you really don't feel much. So we just the endo specialist or a general dentist as well will do root canals. They'll go in, remove the nerve, and then they'll seal the area where the nerve was. So like in the canal, they'll just seal it with something called gutta core, gutta percha, which is, I'm not going to bore you with all the technology, but they just seal it. So it's your natural tooth is just non-vital. So it takes you out of pain, it takes you out of sensitivity. You can start eating properly. You have function to use your teeth to chew with. Because if we start extracting teeth, how are you going to eat properly? How are you going to eat your chicken, your meat? You need those back teeth to chew with. So you really want to preserve the tooth as long as we can.
So basically,
Yeah.
the root canal leaves the teeth there, whichever
Yes.
teeth, how many teeth there are, or a tooth, or whatever it may be, um, disconnects the nerve from it.
Mm-hmm.
But would that tooth decay after time? Would it deteriorate? Tell us.
It can. Okay, so oral hygiene is very important. Okay, so as a dentist, we're gonna do our best to make sure our success of our treatment is gonna be good. But as a patient, and for someone you own that tooth, you want to make sure you're keeping it clean. You got to make sure you're doing flossing, brushing twice a day, keeping up with your appointments, making sure we're getting any sort of bacteria that could lead to another cavity underneath that crown or that root canal area. You're keeping it clean. You got to clean the bacteria.
Okay, so therefore the root canal, as you say, is now more beneficial than extracting the tooth.
Yes, nothing replaces your natural tooth. Nothing.
Wow, that is interesting. Now that you mention nothing replaces your natural tooth, tell me,
Mhm.
what about then? I hear of people taking out their natural teeth, and I
Mhm.
say in teeth because they take out the whole bottom, the top,
Mhm.
and they replace it with other. What is that about, and why do people need that, and should they do that? And tell us.
So there's something called periodontal disease. Okay, periodontal disease is basically inflammatory disease that's in our mouth, right? It's gum and bone infection. So yes, there comes a point where there's 4 stages of it. There's like an early stage 1, stage 2, stage 3, and then stage 4.
Mm-hmm.
Stage 3 and 4 are bad. That's the point that we can't really do anything to save the teeth that are there. So if you are in a case where you have severe bone loss, severe infection in that area, You want to take unhealthy teeth out because you are swallowing that bacteria every day. So it does lead to other problems. Not only that, you're going to cause an abscess and pus coming out inside your mouth as well. And we've seen that. I've seen ages from early 30s all the way to 70s and 80s where patients have severe bone loss. And by the time you come in, they're in pain, there's pus, and at this point I'm just like, yeah, we need to take that tooth out or teeth out at that point.
Wow, that listen, that is a very painful thing. You're right. I mean, I hear people talk about it, and it's like scary. Is it really something to be so scary?
I mean, it's not fun. Of course, dentistry is not fun, but it is, like I said, like if we numb you well, if we're giving you the proper care that's needed, you should be okay. Yes, you're going to be sore, you're going to be in a little bit of pain afterwards, but it's saving you from a lot of headache and problems in the future for you, and health-wise as well.
Right. That makes sense.